Makayla Richards, your host for Uncomfortable Conversations. Georgia has the worst maternal mortality rate of any state in the country. Data shows that Black women in Georgia are 3 times more likely to die from pregnancy-related complications more than white women are. So let's talk about it. I have 3 women with me here to discuss their experiences, provide advice, and resources. Before we jump in on this very important topic, can everyone just introduce themselves?
So my name is Shawana Moore, and I'm an associate professor here in Atlanta at Emory University. And I also am the first African American president of the National Association of Nurse Practitioners in Women's Health, where I just finished up that term in 2023.
Hi, my name is Dr. Quantrilla Ard. I also am an associate professor, but I'm in the School of Public Health at Morehouse School of Medicine, and I am also a maternal and child health champion, and happy to be here.
Hello, my name is Asha Emanuel. I am a mother of 4 and a longtime labor and delivery nurse here in Atlanta. I am a reproductive and racial justice advocate, and I work as a program consultant at the Center for Black Women's Wellness.
Jumping right in Georgia, a pregnant mother overall faces a greater risk as far as birthing, but a Black mother, a Black pregnant person is way more likely to experience complications, racial discrimination. And I guess my first question for you guys is just, why do you think that is? And I'll start here with Shawana.
Sure, so I think a lot of it has to do with structural systems, and I'll just call it right out, structural racism. There are barriers that have been put in place over time that create systems that allow for biases, that allows for inequitable access to quality health care, and that allows for honestly Black women to suffer at higher rates of maternal mortality and morbidity. And again, I say they're man-made. People built them. They can be unbuilt, but it takes a dedicated effort and really acknowledgement of the issue at the forefront.
Once we are now in these areas in which we are disadvantaged, it becomes almost a self-fulfilling prophecy where the cycle continues, where it's oppression, but now we can't fight the oppression. So we are steeped in these systemic oppressions, and it continues to break down and wear our bodies down, which in turn, these negative birth outcomes for Black and brown women and birthing people.
Very well said, and all I'll add to that, you described weathering, which is what happens to Black women. We are prematurely aged by those exposures of racism and social inequality over and over and over, just recurring, right? And it prematurely ages us. And I can say, as a labor and delivery nurse, I saw at the bedside over and over that my Black patients were having worse outcomes than my white patients. And this cut across social lines.
Yes.
It was regardless of income, regardless of education level, that we were having poorer health outcomes.
And in your own birthing experience, what were some challenges or barriers that you faced assessing prenatal care and support?
For me, I share my story nationally on various platforms to bring awareness, but not just to bring awareness, to bring change. And when I gave birth to my son, I was a doctoral prepared assistant professor at the time at a university in Philadelphia, and practicing as a women's health nurse practitioner. And I experienced so much bias and discrimination during my childbirth experience. And I just am so thankful that I was able to have an appointment that day. I ended up being diagnosed with severe preeclampsia and delivered my son at 38 weeks. But I called my healthcare provider multiple times throughout my pregnancy to say something wasn't right. I mean, I had 11-pound weight gain in a 2-week period of time, and I was talked to about dietary. And I knew from my own knowledge as being a women's health nurse practitioner, it had nothing to do with diet. Something else was obviously wrong, but I was kind of really brushed off. But I feel as though if I was a different race or a different color, somebody would have come to the room. Somebody would have came to see what was happening to me. But from my perspective, it shouldn't matter what degrees I have. It shouldn't matter who I know. It doesn't matter what I look like. Every patient that comes in should be treated with quality care. Nobody took the time to really listen to or read my medical history, right? Hear the concerns I had to give me appropriate measures that were already written by national organizations and supported by national organizations. So for me, I had a desire at one point to have more children. My son, his name's Emery, he's 7 now. And from that experience, I'm like, I don't know that I can never go through that pathway again because it was traumatic. If somebody would at least listen to me, if somebody would have validated what I was experiencing and acted upon it, I could have had a completely birthing experience. But I'm just thankful, honestly, that I had an appointment that day because the way I felt, I don't think I would have even called to even get help that day because I'm like, they don't pay me any mind anyway. So who knows, my son or myself may not have been here today had we not had a routine 38-week checkup.
My story is very similar to Dr. Moore's. I didn't really know what was going on. I knew something wasn't quite right. I went in also for a routine checkup, and on that day I was told that I needed to be rushed to the hospital to deliver my son. And my son was born 4.5 weeks early. He was 4 pounds and 8 ounces. And it's literally a miracle that I'm sitting here talking to you and with my sisters here about this topic. What eventually happened was they didn't believe that I could feel the pain that I was feeling. And I eventually felt them cutting me open for my emergency C-section. While my story turned out the way it did, there are still very beautiful birthing experiences despite what we experience as Black women. And just yesterday I had a conversation with my daughter, and it was kind of disheartening because she said, well, I want to adopt. And I said, okay, that's a good thing. I love that. She said, because I don't want to experience what you experienced. And it broke my heart. And I told her, no, mommy is fighting for you, for other little brown and Black girls who look like you, so that you don't have to experience what mommy experienced. So that's a little bit of my story.
Wow. Is there anything on that topic that you would like to share before I move forward?
I don't have personal experience with it, but I have seen it as a labor and delivery nurse. I have seen bias and discrimination creep into the clinical encounter and cause tangible harm of from small to large harm for folks. And I want to lift up that Health Affairs did a survey recently of healthcare providers, and over 50% of healthcare providers, like me, have witnessed bias and discrimination in clinical encounters based on race. So this is a systemic issue, and we have to treat it that way, and it should be a never event. And if they don't get the right nurse who is curious and wants to dig a little deeper into what their concerns are, those concerns are often brushed off until there is a crisis. And the problem with that is that you can often progress to a point of no return.
Wow.
Right? And if you progress to that point of no return, you know what happens.
So we're just looking at a 2023 act that passed. It's called the Healthy Mothers, Healthy Babies Act. And I'm just going to read a little bit about it. So it aims to increase services, access, and support for mothers and children. Some things that were listed in the legislation are telehealth, focusing on whole person care, stillbirth prevention, and trying to understand social issues as they relate to healthy pregnant and postpartum women. This is definitely just a start, but what do you think of this, and what could next steps be?
I think it is a step in the right direction. A lot of times we're very critical of what is currently happening, but we should also champion the things that are going well, right? And I'm very big on whole person care and autonomy. When you care for the individual as a human, it translates into health, better health, well-being. And one of the reasons I do share my story is because a lot of times we can go into these birthing spaces and just feel like a carrier. So rehumanizing the birth experience is very important, because when you care for the entire person, how are they feeling? What are their needs? What are the surrounding nuances to their experience? They're not just there to deliver a baby. This is a person that's connected to a family, that's connected to a larger community. And when we shift our thinking to a super clinical aspect of birth and we neglect everything else that surrounds it, that's when you have those negative birth outcomes. So I'm proud to hear that there is a whole person-centered care aspect of that, and I hope it's just the first step and that it gets better from there.
I think it's a step in the right direction, but when I think about other legislation around reproductive health, specifically abortion care, I think about the implications of that as well. So for me, I think it's a step in the right direction, but when we think about the whole person, I can't help but still think about reproductive access and reproductive rights as a part of that. So you can try to contribute to addressing one issue while neglecting such an important problem and potentially denying access. And I know this conversation isn't necessarily around reproductive access and rights, but I can't help but not to separate the two because maternal health to me comes in collaboration with reproductive health. So I'm a bit torn, but I think the legislation isn't a move in the right direction, but I think there still needs to be concerted efforts around reproductive health and access in the state of Georgia when it comes to access to abortion care, which we know is evidence-based health care.
Well, I would love to lift up a project that the Center for Black Women's Wellness did in collaboration with the Institute for Healthcare Improvement, funded generously by Merck for Moms. The project was called Better Maternal Outcomes, Redesigning Systems with Black Women. Because we have ideas, we have solutions. What would drive an improvement in equity, safety, dignity, autonomy in maternal health for Black people who birth in Atlanta? And we found that there are 3 primary drivers to do that. The first is respectful care. This is foundational. We have to have respectful care, but there are 2 sides to that coin. One is about empowering Black women to expect and demand respectful care, and the other side of the coin is helping the healthcare team deliver respectful care. The second driver is about shared leadership, and we want to make sure that data is accessible, that it's exchangeable, and that it's usable across a variety of care settings, because moms don't just seek care in one location. They're in community, they're in clinical settings, and often in multiple provider settings. And each of those providers don't necessarily communicate with each other in terms of data access. And the last one is about supporting women across silos through community-based support. And this is where we want to lift up doulas and lactation support and perinatal community health workers, because they're all game changers, creating seamless handoffs between community and clinical entities. There's resources on both sides, but we're not talking. And then the last one is about establishing peer support networks for Black women so that we can have communities of support for solidarity, for resources, and other things. So that is what our community-based participatory research found. That's what we need. That's the solution to solve this crisis.
Knowing what you know now, how do you engage with communities, particularly Black mothers, to raise awareness about maternal health issues and resources?
So I think it's platforms like this. So being able to get in front of appropriate audiences to share stories, to share experiences, to share resources that are addressing this issue on a day-to-day basis. My 3-fold things is listen to Black women, validate what Black women are saying and experiencing, and act upon that. So I think it's really multifaceted, and it takes a village. I don't think not one of us here does this alone or in silo. And I think community has to be at the key of it. Having a strong connection to community partners, community leaders, and the patients themselves who are within those community places.
And for me, I typically come into spaces as a community voice, as a lived experiences expert. So I'm the person that always comes to the table and says, well, what about the community? Is there a community member here at this table? Do they have voice and agency at this table? And so I have a research background. I also have a lived experience background. But if we don't ever bring the voices of the community to the table, they won't ever get to see the necessary change that is needed in the community. To me, they are the voice of the change. They know what they need. We just have to empower them. We just have to give them the access to make those necessary changes.
This is my passion.
Yeah.
I left the bedside and made a beeline for community because it was the only place that I felt was holistically meeting needs of my community.
Yeah. And then what advice would you guys give to families as they're, planning for children?
The biggest thing I would say is you as a patient, you are a critical part of your healthcare team. So you matter just as much as the physician, the nurse practitioner, the nurse, the community health worker, the doula. You are that centerpiece of that team. The other thing I would say is make sure you do your due diligence as well and look for healthcare providers that you can relate to. I know for me, I went online when I was looking for a therapist to find a Black female therapist. There are tools out here now where you can find people that look like you, that may have come from communities like you, because we know that the data says when your healthcare provider team looks like you, has similar background as you, your health outcomes tend to be better. And I always say the power lies within you. You have more power than you think you have.
I totally agree. And I would add that, to remember that you are the expert of your own body. No one lives in that body but you. So you understand exactly what's going on. Ask all the questions. And if there's a problem, if there's a concern, you have to speak up, or at least have someone who can speak up for you.
Very good advice. And I would add just a tool to help do what you both have just talked about, and that's the Earth app. I want to see every pregnant person, parents, use the Earth app. It is the #1 Yelp-like platform for Black and brown parents, created by a Black woman, for Black women and brown women and birthing people to read reviews about prenatal care, intrapartum care, postpartum care, and pediatric reviews from other members of the community. So you can see trends, you can identify, is this provider providing respectful care or not? I view it as a modern day green book. And I think it is a critical tool to help expecting parents navigate their birthing journey.
I always see examples online of medical textbooks where there is a racial bias in there. That's inherently taught to medical professionals. Did you guys experience any of that in your education? Did you see any of that?
So you got to think about it. The foundation of obstetrics and gynecology was built on racism, right? And we always talk about the father, Dr. Sims, of gynecology, but he misused enslaved Black women to learn about the profession, to learn about the field. So I'm like, if you have a field that's built on structural racism, that creates a sequel of events where it's written about it, it's taught in schools. The beauty of it is we all have the ability to change it by sitting at those tables, writing those textbooks, addressing curriculum that shows bias in it. At Emory, I serve as the MSN, so Master's and Doctoral Program Director. So I oversee all of the nurse practitioner specialties. So in a very unique position to ensure curriculum is not racially biased, is not discriminatory. I have a team around me who are all driven towards the same mission. We have something within our curriculum called social determinants of health, where that's embedded in our curriculum, and every single course has to ensure these structures are addressed. But being able to have positions and sit at tables where you can influence that change, I think is critical.
Things that I've seen in my research has been, for example, the C-section calculator. That tool in and of itself is not a tool that is based on a large group or a large population. We have to make sure that the data and the tools themselves have implicit bias in them. And so that's one of the things that I try to highlight every time I do this research, is that what are the measures that we're using for Black and brown women and birthing people? Are those accurate? Are those community-based? Are those centered and focused around people who have the largest impact? And if they're not, then we need new tools. We need new ways to collect data and ways to accurately and respectfully represent that population.
I graduated in 1996 from Emory University, and I remember my Mosby Women's Health book. It's a huge, huge book, and there was a breakdown of how different races might display pain.
Wow.
And I remember reading that thinking, that's not how I would how I would display pain as a Black person. But it very clearly said that Black people don't necessarily feel as pain as much as others.
Wow.
So that was there, and I'm grateful to hear that now that the curriculum and the textbooks are shifting.
Yes. And then just wrapping this up, what advice would you give to Black people as they look for advice on family planning?
If you go to mpwh.org, there's a tool where you can search for nurse practitioners across the country that provide equitable care to diverse populations. One of the key things within that organizations that I had the opportunity to lead was updating our bylaws to be inclusive, diverse, and equitable. So that's an excellent tool you can use to review various nurse practitioners across the country that are providing equitable, quality prenatal, postnatal, and intrapartum care.
If you are looking for a provider in your area, there's another tool called Health in Her Hue, where you can enter in your zip code or you can enter in your city, and you'll have a list populated of specific practitioners who are either Black or who identify as Black or brown in your community. And I know this is always, a stretch when we're looking at maybe rural communities who don't always have that large option, but they can still search for providers who look like them, who are in at least close to their geographic region.
Well, certainly the Center for Black Women's Wellness, I have to rep for them. We have been serving our community for 35 years. We are a community health clinic. We have the Atlanta Healthy Start initiative with a fatherhood program because we want to serve the whole family. We recognize that in order to really move the needle in perinatal outcomes, you have to focus on the family unit as a whole. So I would lift up the Center for Black Women's Wellness for sure as a resource.
Thank you. And then any final thoughts that you guys have from this conversation that you'd like to add?
I just always like to wrap it up with listen to Black women, validate what Black women are experiencing as well as birthing people, and last but most importantly is act upon their experiences.
I think I would say that your story is your activism. Your story is your resistance. Keep telling your story, keep sharing your story, invite others to do the same because they can't ignore you unless you don't speak.
And I would add, listen to and prioritize the concerns of Black women. If we can improve the Black maternal health in this country, we will improve maternal health for everyone.
Ooh, that's good, yeah.
Thank you all for joining us for this episode of Uncomfortable Conversations. To see our other episodes, head to the 11 Alive exclusive section of our 11 Alive Plus streaming app. Watch our content on demand by downloading our app on your Amazon, Fire Stick, Roku, or Apple TV. Scan here to download. See you next time.